We are speaking to Sven Byl. He's head of healthcare at KPMG, who's released a report on the economic impact of the proposed national health insurance. And we're all waiting with bated breath to hear what you have to say. Do we need to be nervous?
Well, good afternoon, and thank you for having me. No, in fact, the good news is we can be both richer and healthier at the same time. So, new study out from KPMG today, essentially looking at the economic impact of the NHI, but also looking at the knock-on consequences of increased productivity and increased health of our population. And essentially, the story is quite positive. If the NHI is well implemented, even if taxes need to increase, and we've modeled 3 different scenarios, which we can discuss in a bit, we expect that GDP will grow on a per capita basis from 1,500 to anywhere to about 2,100 Rand per person.
I don't want to be a naysayer, but the key terminology there is that NHI needs to be well implemented. What are the chances that it's going to be well implemented, given the inability of some sectors in the economy to deliver on promises and to execute effectively?
It's a very clear priority for government. I'd say that's the first. I'd say it's a second if you just look at the global view about why countries are investing so much in their capacity in their health systems. It's because when you're spending as much as South Africa is on its education system, you need to not only protect that human capital investment you're making, you need to accelerate it. And so in order for South Africa to be successful, for it to compete against its trading partners, it needs to develop a healthy, well-functioning healthcare system.
Sven, there's obviously no doubt that South Africa needs a better health system than we've got at the moment. You indicate that in order to do this, you've got different scenarios on how much this is going to cost. Can you give us some idea of what sorts of effect, in terms of the cost effect, one would be looking at?
Yeah, we do. The government's come out and said that it proposes the NHI to run about 10.4 billion Rand more per annum between 2012 and 2025. So that's up and above what government currently spends on health. 3 models to fund that. Obviously, government has 3 levers it can pull. One lever is personal tax. To fund the NHI entirely from personal taxes, it would be an increase of 1.1 percentage points. To fund the NHI entirely from consumption tax or from VAT, it'd be an increase of 0.8%. And lastly, to look at sin taxes, to look at those things that are, of course, most unhealthy for us. That bottle of wine you like would go up by about 80 cents. If you smoke, a carton of cigarettes, 20 cigarettes would go up about 5 Rand. And for alcohol, 40% proof, it would be 13 Rand. So those are the 3 scenarios if the extra 10.4 billion were entirely funded by one of those options.
So the VAT proportion then, if it was entirely funded by VAT, am I correct in saying that it would be 14.8%?
That's
VAT.
right.
Would that impact the consumer in South Africa?
No, that would be a fairly mild effect. What I would be wanting to question Sven about is the total cost, because the cost numbers that you're suggesting, from my recollection, are quite a lot lower than what government itself is proposing in terms of the cost.
We've based our modeling on the NHI Green Paper, which came out in August, and is the government's and the Treasury's best estimate today to implement the NHI as they defined it. There are obviously views, I think, about what the appropriate costs are. To take a moment and just to say that the 10.4 that they have perceived can be funded in 3 ways: either tax increases, a reallocation of other government departments, or borrowing. A view, of course, that borrowing is essentially foregone taxes in the future, and so a view that taxes would probably need to rise in order to meet the challenge of the NHI.
In terms of looking at the NHI, does your report focus on the idea that healthcare is important for the country, or does it delve into the ability for South Africa to deliver an appropriate national healthcare?
We've taken efficiency and productivity benefits starting much later into the implementation period. So in fact, our projections don't really start until 2015, going into 2025. Also, we know that on average, developing countries that have implemented health insurance systems have seen productivity and efficiency benefits of anywhere between 20 to 47%. We operate in 144 countries. We have a very good view of health systems around the world. We've taken a very conservative view here, thinking thinking that there are some bottlenecks that government needs to iron out. There's some capacity that government needs to build. Our view has been that we see a 10% increase. So that number of between 1,500 and 2,100 rand in terms of a per capita increase of the extra wealth we can see that an NHI could deliver is based on a 10% increase in productivity and efficiency in the country. I mean, to put this in stark contrast for you, countries that are able to raise its average life expectancy by just 1 year can add 4% to its average GDP in the long run. That means essentially adding between 0.2 and 0.3 percentage points to our GDP in the fiscus for the next few years, and that's good news for South Africa.
Certainly a figure to be very positive about.
Sven, just you can hear from Bronwyn's and Kevin's questions. Implementation is going to be key in delivery. From your analysis of other countries and how they've gone about implementation, what are some of the challenges that they've found and some successes that they've found?
Big challenges, if you look, for example, the health reforms even in the United States. This has been many, many years in the making. I mean, from Franklin Roosevelt all the way down to Barack Obama. Today you finally see some major health reform. This takes a very long time. The government's prudent to put out about 17 to 20 years for implementation. It can do it quicker. And there are some economic benefits to doing so. Its biggest risks are essentially around health human resources, being able to attract the right doctors and nurse practitioners and nurses and allied health professionals that South Africa needs. In some cases, this is about repatriating people that may have left the country. In other cases, it's about building capacity here locally, and that will take some time. They have a very aggressive public-private partnership program, which if they were to be more permissive in terms of allowing different models of care between the private sector and government, could also ramp up capacity quite quickly. But you know, the stark contrast is other countries in Africa will move on this very quickly, and all of the countries are beginning to experiment with different models of healthcare, and that's good news, but it's also a competitive threat.
Sven, thank you very much for your time. Sven Byl, Head of Healthcare at KPMG.